Mayra Rostero Jordan. I am studying at the Catholic Santiago de Guayaquil nursing career. My topic is Osteitis fibrosis cystica. What is Osteitis fibrosa cystica? Definition: is a skeletal disorder that results in a loss of bone mass, a weakening of the bones as they are calcified supporting structures, are replaced with fibrous tissue, and the formation of brown cysts like tumors in and around the bone.
We'll discuss the effects of hyperparathyroidism on bones. So basically, hyperparathyroidism causes three principal lesions in bones. These three lesions are osteoporosis, brown tumors, and osteitis fibrosa cystica. The first characteristic abnormality caused by hyperparathyroidism is osteoporosis. And this osteoporosis is visible microscopically as histologically normal bone that is just decreased in quantity. So in osteoporosis caused by hyperparathyroidism, there is no change in quality of bone. There is just decrease in quantity of bony matrix. Now the next lesion is brown tumors. So what happens is that hyperparathyroidism causes activation of osteoclasts, and this osteoclast causes degradation or destruction of central parts of bony matrix or bony trabecula. This leads to railroad-like cavitations in the bony matrix that we call as dissecting osteitis. So what is dissecting osteitis? It is railroad-like dissections in the bony matrix. Now in the next step, as a repair mechanism, the fibrovascular tissue starts proliferating in the dissected regions. This growth of fibrovascular tissue in the places where previously there was degradation by osteoclast is called brown tumors. So what are brown tumors? Brown tumors are actually the masses of fibrovascular tissue that are formed in the places where previously there was degradation caused by osteoclasts. And these brown tumors are actually brown because of the hemosiderin that is derived from macrophages. And you all know that these macrophages have a very important role in the ingrowth of this fibrovascular tissue. So these brown tumors appear as brown. So you can see here in this diagram that there is a brown color mass that is surrounded by pink colored bony matrix or fibrotic areas. This mass is known as brown tumors. Now the next lesion is osteitis fibrosa cystica. So what happens is that with the gradual course of time, these brown tumors undergo degeneration of the central part, and this degeneration of central part in brown tumors leads to a cavity in the brown tumors that is surrounded by a fibrous tissue. These cyst-like cavities surrounded by peritrabecular fibrosis are known as osteitis fibrosa cystica. So osteitis fibrosa cystica is caused by cystic degeneration of brown tumors.
Obesity. Applications in nursing. OBC is currently detected by a combination of blood tests, X-rays, and tissue samples. One of the symptoms that is most noticeable when there is OFC is pain and tenderness in the bones. Present as a bone pain and characteristic radiographic findings including superosteal bone resorption in the middle of the phalange and distal radius, thinning of the distal clavicle, bone cyst formation, salt and pepper, pattern of the skull brown tumor affecting the bone's length and osteopenia. Issue applying in Ecuador. A 33-year-old woman came to the Luis Bernaza Hospital who represent with a 5-year history of generalized body pain and inability to use her right upper limb after a fall. She also had fatigue, nausea, and a history of weight loss, a central neck mass that moved with swallow but was not discreetly palpable, an incision and a curvature of the right ilion lesion was made. and histopathology report is a brown tumor of hyperparathyroidism. Conclusion: blood problems resulting from OFC usually resolve after parathyroidectomy. Proper management of hyperparathyroidism result in decreased asoclas activity and newborn disposition. However, early diagnosis and treatment of hyperparathyroidism may also limit the amount of damage caused by OFC. An annual medical checkup, which includes tests for serum, calcium, and phosphorus, can help in the early detection of asymptomatic hyperparathyroidism and limit its long complications.
Everyone, welcome back. So today we would be discussing about Osteitis fibrosa cystica in CKD. CKD is a short form that I have used for chronic kidney disease. But as you can see that I have divided my entire video into 4 subtopics, and they are: A. Parathormone functions, B. Chronic kidney disease, in short, pathophysiology of OFC in chronic kidney disease, where I would be integrating and telling you that why in a chronic kidney disease would osteitis fibrosa cystica occur, and lastly we would be deriving the disease osteitis fibrosa cystica itself from the 3 previous topics, right? So yes, I have divided them into 4 subtopics, and I have divided my entire video into part 1 and part 2. Part 1 would be containing the topics A and B, and part 2 would be containing C and D, and part 1 is this video itself. So if you think that you know the parts A and B very well, you can just skip this video and move on to the next video, which would be part 2, and I would be uploading it very soon. So let's get started. So let's look at topic A, that is parathormone functions. Now, if you look at this diagram, this red colored or a brown colored gland is the thyroid gland, okay? And this, you are looking at the thyroid gland from the posterior aspect of it, right? From the posterior aspect, these yellow colored glands are your parathyroid glands. They are 2 on each side, and so they are 4 in total. And these parathyroid glands release what? They release a hormone which is known as parathyroid hormone or parathormone or PTH, right? That is what is the short form that we use. Now, let's look at the function of the parathormone on our body. So the parathormone primarily acts on 3 organs in our body. Number 1 is bone, number 2 are the kidneys, and number 3 are the intestines, right? So let's look at its action on the bones first. So on the bones, it would be acting on the osteoblasts, right? The parathormone would act on osteoblasts. The osteoblasts in turn would act on the osteoclasts. And wherever in biology we use the term clasts mean to break down, right? To break down, which means to eat up. So what would they eat up? They would be eating up the bone, right? They would be eating up the bone, and they would cause a bone resorption, right? And this bone resorption in turn would release what? In turn would release calcium, and this will cause an increase in the serum calcium, okay? Now on the kidneys, the parathormone has 2 functions. Number 1, it will increase the serum calcium or absorb calcium in turn for phosphate. So phosphate would be reduced and calcium would be increased. And second, it would convert calcidiol, which is vitamin D2, into calcitriol, which is vitamin D3, right? But parathormone would do this with the help of an enzyme, and the enzyme is known as 1-alpha hydroxylase, right? So parathormone on the kidneys has two functions, and this calcitriol is an activated form of vitamin D. So this will go and act on the intestines, and on the intestines it would again absorb calcium from the gut, and this would lead to an increase in the serum calcium. So if we look at the function of the parathormone in gist, what is it trying to do? The parathormone